Good morning, dear students. My name is Muhammad Magid. I am a lecturer of neurology at Shams University. In this video, I'm going to show you how to examine superficial sensation. Okay, so as all examination, we have to start with greeting the patient and explaining the procedure itself. ازي حضرتك؟ دكتور محمد ماجد مدرس أعصاب. هستأذنك أفحصك. And now we're going to examine the superficial sensation. First of all, we have to start by setting a reference point on the patient's hand. تمام. ماشي هشكك وقول لي بس حاسس بالشكة ولا لأ. Okay, so I explain to the patient I'm going to use the pinprick and he needs to tell me if he does feel it or not. ماشي حاسس بالشكة هنا. Okay, first of all, we need to remember the modalities that we're looking for or the differences that we're looking for. Either hemisensory loss or a superficial sensory loss or glove and stocking, or a sensory level, and finally dermatomal. Okay, so first of all, I'm going to compare right and left. So now that we've compared right and left, we're going to look for either a glove and stocking or a sensory level. So I'm going to start with the most distal part and compare it to the reference point. تمام. حاسس هنا زي هنا زيهم زي فوق. Okay. تمام. Okay, so the patient is already feeling the same sensation. If there is an abnormality, I'm going to start going upwards and explain to the patient that whenever he feels it's starting to get to the same point, he needs to tell me. طيب أنا هطلع من تحت لفوق ولو في اختلاف قول. Okay, so again I'm going to start with the most distal part and go upwards. I'm looking for a peripheral sensory loss, or if the patient is still not feeling, I'm going to go upwards until I get a sensory level. Okay. Lastly, we're going to look for a dermatomal sensory loss. I'm going to compare different dermatomes. Okay. حاسس هنا زي هنا هنا زي هنا هنا زي هنا هنا زي هنا هنا زي هنا. And I'm going to do the same in his upper limbs to look for a peripheral sensory loss. ماشي حاسس هنا زيها زي فوق. تمام. هنا زي هنا. تمام. هنا زي هنا. ماشي. هنا زي هنا. ماشي وانا طالع كده في اختلاف في الإحساس. So again, now I have checked for a peripheral sensory loss or a dermatomal sensory loss by comparing different dermatomes and by checking for glove hypothesia. Okay. Last thing, we're going to palpate for the nerve. We're going to palpate for the ulnar and the common peroneal. For the ulnar nerve, its landmark is behind the medial malleolus. See نفسك خالص. So behind the medial malleolus, between the medial malleolus and the olecranial process, I'm going to palpate for the ulnar nerve. So I'm going to palpate for the ulnar nerve just behind the medial malleolus, in the groove between the medial malleolus and the olecranial. I'm going to palpate for the ulnar nerve, for any nerve thickening. Okay, the same goes for the other side. The groove, palpate for the ulnar nerve. And then the common peroneal nerve, which is located behind the head of fibula. So on the outer aspect, I'm going to check or palpate for the head of fibula and then feel for the nerve just behind it. So to conclude our findings regarding the optic and the ocular examination, we have to explain each eye if there is any decrease in visual acuity or abnormalities in color vision. We have to comment on the light reflex, either direct or indirect, and we have to comment on the ocular motility, either single or conjugate eye movement, as well as the presence of any ptosis, proptosis, or nystagmus. Thank you.